The senator from Iowa.
First of all, Mr. President, let me commend the senator from New Hampshire for her great leadership as a governor and as a United States senator in this whole area of health care for women, especially. She's provided great leadership in this area, continues to provide that leadership, and I just want to join with the senator from New Hampshire in saying that we're not going to let these provisions that now are expanding coverage for so many women, 47 million women in America, we're not going to let these be rolled back. We're just not. Now, again, if the people of this country elect Mr. Romney to be president and they turn over the Senate to the Republicans, there it goes. It's gone. It's gone. I did not hear this morning, but I understand the Republican leader said this morning, I stand to be corrected, but as I understand, he said that they wanted the First Amendment that would be offered on the cybersecurity bill that I think is now before the Senate. He wanted the First Amendment to be a repeal of the Affordable Care Act. What timing? What timing, I say to the Republican leader, on the eve of when we are expanding preventative health care services for 47 million women in America. The Republican leader gets up and says, we want to vote to repeal this tomorrow. Tomorrow, repeal it tomorrow. Does that kind of give you some idea of how they feel about the women of America and the health care of our mothers, our sisters, our daughters? That's what they want. We've already voted 33 times to repeal portions of the Health Care Act. I think we voted twice in the Senate already to repeal the whole thing. They want to have another vote. But I think it's just more than passing curious that the Republican leader wants to vote to repeal it on the very day when we're expanding health care coverage for the women of America. Interesting. Interesting. Tomorrow is an important day for American women. Thanks again to key provisions of the Affordable Care Act. And here I do want to commend Senator Mikulski for her great leadership in this area, Senator Dodd, Senator Bingaman, Senator Kennedy, when he became ill, asked us to take the leadership on different provisions of the Affordable Care Act in the Help Committee and to get it through. We had wonderful support from our colleagues here on the floor of the Senate and our committee. And these provisions that we put in to move us from a sick care system to a health care system. I've often said that in America we don't have a health care system, we have a sick care system. If you get sick, you'll get care one way or the other, usually in the emergency room if you're poor, or maybe not at all if you don't make it to the emergency room. But there's very little in our country to keep you healthy in the first place. And yet we know, we have good data, that we know that preventative services up front saves you a lot of money and a lot of lives and a lot of pain and suffering later on. So in the Affordable Care Act, we put in a big provision on preventative services. And we said basically that what the Preventative Services Task Force of the Center for Disease Control and Prevention, what they listed as their A and B, those that had the, if I could use this term, best return on investment, or the biggest impact, that those would be free. There would be no co-pays, no deductibles. Senator Mikulski said, but you know, she reminded us of what is obvious but not too often taken into consideration in legislation, that is, women are different than men. And so we asked the Institute of Medicine to come up with provisions that apply to the preventative health care of women. That's what goes into effect tomorrow. Senator Boxer very eloquently talked about that and had the chart showing all of the different things that would start tomorrow and all new plans that would cover women in this country. And again, to keep women healthy in the first place, preventative services to keep women healthy without co-pays and without deductibles. And right on the eve of this, wonderful expansion of health care coverage, of making sure that women are not second-class citizens when it comes to prevention and wellness. On the very eve of saying to women that no longer can insurance companies sort of say because you're a woman, you have a pre-existing condition. On the very eve of that, the Republican leader gets up and says he wants to have the next vote on repealing the health care bill. Talk about a slap in the face to the women of this country. Well, I think women know what they're facing now, coming up this fall. I just point out that tomorrow, 519,000, actually about 520,000 women in Iowa will have expanded health care coverage, preventative services. We fought very hard to put these in the law, and we are not going to let them repeal it. We have the votes, let's face it, we have the votes here in the Senate to stop that. I mean, the Republican leader can bring it up again, we voted on it before, but I think it's indicative of where they want to take this country. We can stop it now. But if Mr. Romney is elected president and he says on day one, he wants to repeal, when he's first sworn in, he'll send up legislation to repeal it. And if the Senate is in Republican hands and the House in Republican hands, you can kiss it goodbye. It's gone. We won't be able to stop it then. It's hard to believe, but prior to the Affordable Care Act, essential services that were unique to women, maternity care, for example, were not even often included in health plans. Tomorrow, we can include free preventative checkups, well woman visits, free screening for gestational diabetes, and breastfeeding support and supplies. How many low-income women in this country would know that the best thing for their babies is breast milk? Breastfeeding, we know, is the preferred method of starting babies off. But sometimes these supplies can be expensive. And especially if they're working, and they're working at a low-wage job, they may need these supplies. But they can't afford it. So therefore they turn to other methods, to formula for their babies. I'm not saying formula is bad, but it's not, we know, doctors will tell you, every pediatrician will tell you that breastfeeding is the best. But women would be forced to choose a less best option if they didn't have these breastfeeding supports and supplies. And let me take on head on, if I can, a little bit this idea of, well, contraception. Well, as the senator from New Hampshire pointed out, this can be pretty expensive, up to $600 a year or more. Now, I suppose for one of us here making, what do we make now, $172,000 a year, and we got great health care coverage, that's not a big deal. But you take a low-income woman, got a couple of kids, working at a minimum wage job, trying to scrape by just enough to get by. Yeah, $600 a year is a lot of money. Let me point out another facet of this. That somehow people seem to have this idea that, for example, birth control pills are only to prevent a pregnancy. There are many young women of childbearing age in this country who take birth control pills on the advice of their doctor, not to avoid a pregnancy, but because their monthly cycles are so painful that they can't even work. And so, what are we saying now? A young woman has to get a prescription from a doctor and says it's not for birth control methods, but it's for other physical problems. You have to take that in and show that to your employer now? You have to take that in and show it to your insurance carrier? Make women second-class citizens again. Nonsense. Nonsense. I respect religious freedom as much as anyone. But despite the Republican propaganda, this law does not mandate that any woman has to use contraception, and it does not force employers to dispense it. What it does is it gives women affordable access to birth control for a variety of reasons, should they or their doctor decide that it's right for themselves and their families. As for religious organizations that object to contraception, the President has issued a very sensible compromise to accommodate their beliefs while ensuring that women have access to this critical service. I respect, as I've said, the views of all people on these divisive issues. I would oppose any measure that threatens the fundamental religious liberties of individuals or institutions. But I say this very clearly. The Republicans on that side of the aisle are not motivated, I don't believe, by a genuine desire to protect religious liberty. Rather, they are determined to undo these and other benefits for women in the Affordable Care Act. They've repeatedly introduced legislation approved by the House Appropriations Committee that allows anyone to opt out of providing any services to which they have a religious or moral objection. Well, you might say, well, that sounds reasonable on the face of it. But think about this. Any employer for any religious or moral objection could opt out of any coverage. Well, you could see them, and they could say, well, not only contraception, but mammograms, prenatal screenings, all these other things. I just have a moral objection to that based upon my religious belief. I mean, I respect Christian Scientists. I've always respected them and their beliefs. But can they say then, well, then we're not going to cover insurance for an employee who goes to see a doctor for allopathic medical care because we don't believe in that. That's not our religious belief. In all these things, we have to have reasonable compromises, and I believe the President has come up with a reasonable compromise. So what the Republicans would do, according to their leader this morning, they would rob 47 million women of these new preventative services. 47 million. And they would rob 1.1 million young women of the insurance they've already gained through the Affordable Care Act's extension of dependent coverage. America's women are not going to be dragged backward. They're not going to allow health insurance companies to return to the policies and abuses that hurt them and their families prior to the passage of the Affordable Care Act. Tomorrow marks another step forward in transforming our current sick care system into a true health care system. And many women will now experience this firsthand. So we are going forward. The Republicans can bring it up time and time and time again. They have sent a very clear signal to the women of America. Whatever you've gained under the Affordable Care Act, all these benefits, we're going to take them away from you if you put us in office. I think the women of America need to have some really deep soul searching about who they want deciding their fate in the future after this next election. Mr. President, I yield the floor.